Welcome to our first webinar, where we hope you will hear all about our master's course that we offer here at King's College London in the area of dementia care. We will begin by providing you with a presentation about the course, which we expect you will take about 30 minutes, and we invite you to type in your questions as we go along, and we'll answer them at the end of the session. So just to introduce myself, I'm Angela Hodges, and I'm the Masters in Advanced Care and Dementia Programme Leader, and I have my two colleagues here as well.
My name is Ben Harrison. I'm the Programme Administrator for the course.
My name is Neil Robertson. I'm Associate Director for Education and Training at the South London and Maudsley NHS Trust. I work also at the IOP, and I'm a module leader on the course.
So we'll begin by just telling you a little bit about where our campuses are in King's College London, because our course is run at the Institute of Psychiatry, which is based at the Denmark Hill campus in King's College London, which you can see here on the map. All of the campuses in King's College London are centrally located in the centre of London, as you can see here, with the river flowing through the centre of London. Some of our teaching on our course is in collaboration with the Nightingale School of Nursing and Midwifery, which is, as you can see here on the map, Waterloo campus, which is right down here by the River Thames. So a couple of the modules you would be expected to attend sessions at the Waterloo campus, but the vast majority of the sessions are taught at the Denmark Hill campus there, as you can see. Our course sits within the Department of Old Age Psychiatry, which is based in the Institute of Psychiatry, and it's a collaboration between and a very close partnership with our local NHS Trust. For those of you that don't know what the NHS Trust is, it's really the mental health care provider in South London. It's the only healthcare provider for mental health in South London. And it caters for a population of about 1.1 million people, and it has about 4,800 staff within the NHS Trust across 100 sites, and about 39,000 people in the community are provided for, and there are 68 inpatient care facilities as well. Within the Department of Old Age Psychiatry, which is part of King's College London, we have a very active research program. So a lot of our people have clinical roles, but they also participate in their own research programs. So within old age psychiatry, our aim is to develop new treatments and find ways of developing the best for our patients from treatments that are already available, so getting greater benefit from them. We are a department made up of various clinical academics, psychiatrists, clinical psychologists, and also non-clinical academics. And in fact, I'm a non-clinical academic. I have a lab-based research program looking for blood biomarkers for Alzheimer's disease. We also have a number of postdoctoral researchers, PhD students, and of course our MSc students on this master's program that we're telling you about today. And the teaching for our MSc really is a close partnership, because a lot of our teachers come from our local NHS trust and teach and deliver learning in their own area of expertise. Another area of our research program in the department is the basic biology of Alzheimer's disease, trying to understand the clinical features, the etiology of psychosis, and we also conduct a number of randomised controlled clinical trials which are internationally regarded. So now we're going to tell you a little bit more about the MSc Advanced Care and Dementia. On this course, you will learn how to integrate biological, psychological and social models of dementia into professional practice that isn't necessarily just clinical practice, because we hope that some people might go on to work in the policy area or perhaps even undertake further research at PhD level as well. Now, Neil Robertson, who's here, is going to tell you a lot more about the biological, psychological and social models of dementia that run across the program. We hope throughout the program you're going to learn person-centred approaches to dementia care, because these are very important areas that you should know about. And during your study, you'll also be able to understand how to critically evaluate research evidence and reflect on professional practice to improve dementia care. And in fact, a lot of our assessments throughout the program, there's a lot of requiring you to reflect on professional practice, incorporating in the evidence that you're learning, the knowledge that you're learning. You'll also learn a lot of skills and knowledge to undertake research in the area of dementia care, which actually are fairly generic skills and knowledge that you'll learn, so you'll be able to apply them to all sorts of research. But at master's level, although it's not considered purely a research degree, there's a lot of skills and knowledge that you'll learn that will allow you to undertake your own research if that's your choice in the future. And throughout all of the program, it's all based on taking the evidence from the literature and applying it in practical ways in dementia care settings. The types of people we're trying to attract to the course are very highly motivated health and social care professionals. Now, it might be that you haven't necessarily done clinical work in the past, but that you have some understanding of dementia care in whatever setting, and you care passionately about improving the lives of people with dementia, and you want to advance your careers in this important area. This is just a list of some examples, but it isn't exclusive. So the types of people we've had on our course, which has been running now for 2 years, are nurses, a lot of mental health nurses, of course, occupational therapists. We are very interested in trying to develop the skills and knowledge of care home managers and social workers. We also have, a little bit to our surprise, I suppose, but a lot of interest from psychiatrists and GPs. But we also have some students who've come from a psychology background, and whilst they haven't had specific clinical experience, their aim in the future is to move into the policy area, which is very well needed in dementia care for the growing problem of dementia. Our course is one of only a handful of specialist postgraduate dementia course offered in the UK, and this is why we really started the course, because we knew that there was a huge demand and gap in this area, and it's an important problem for the future. It's taught by internationally recognised leaders in dementia research, and as I've already indicated, we cover a biology, psychosocial aspects of dementia care, which we'll talk a lot more about in a little while. And we feel that our course meets the urgent need for specialist training to really drive up the quality of care experienced by people with dementia. And it might be that you drive up that care by offering what you've learned in the course to other colleagues, so showing more of a leadership role and teaching other people about the things that you've learned. Just in the UK alone, and I know the figure is of course vastly higher worldwide, but in the UK alone there's 822,000 people living with dementia, and I think probably most of you would know that this is really going to double in a generation, and by 2050 it's estimated in the UK there'll be 1.7 million. Of course this number's hugely greater worldwide, and in fact I think it's fair to say that dementia is often underdiagnosed, so the numbers are probably are much higher even than what we think they are. During the course, we take a blended learning approach. We don't actually at this stage offer the course as distance learning, but it's something that we're planning to develop in the future. And so at the moment it's blended learning, which involves tasks led by teachers by e-learning, but you'll also attend lectures, do group work, tutorials, and also conduct your own research project under supervision. You may choose to do the course as a 1-year full-time course starting in September, or as a 2-year part-time course, again starting in September. For those of you that are international students, in order to get a visa, you have to come and do the courses full-time only. So the full-time course, as you would expect by the name, requires you to be here and study either independently or come to different teaching sessions across the whole of the week, or 5 days out of the week, should I say. The 2 years part-time course, the expectation is that it's a commitment of 2 days per week. One of those days is what we call a contact day, and it's a Monday in the first year leading up to Christmas, and then it's a Tuesday thereafter, where you will expect to come for your lectures, your contact day, where you come for the physical lectures and meet the teaching staff that way. Some of those weeks that we call a contact day might be actually self-directed learning, so some of the e-learning tasks. But in order to complete the whole of the course, it is expected that you'll commit the equivalent of an extra day a week. How you organise your own study is entirely up to you, but we expect it will be roughly an extra day a week. So just to summarise that, the 2-year part-time program is a commitment of about 2 days per week with short breaks at Christmas and Easter. So it runs over the summer, unlike undergraduate courses. but in the second year you would finish the course effectively in the July. The master's course, as most courses in the UK are offered, are on a credit-based system and usually divided into modules which are defined by particular subject areas. However, we hope when you're learning in these modules that you're actually putting all the things that you've learned together to build up your full picture of dementia care. And so the modules that I've got listed here, you can see there, measurement and evaluation for healthcare practice, are listed roughly in the order in which you would do the modules. So this first course here, measurement and evaluation for healthcare practice, is actually taught at the Waterloo campus, and you will be, because it's very generic skills on qualitative and quantitative assessments and analysis of data, those kinds of research skills that you need, then you will be sitting in with students doing other master's courses, for example, in, say, cancer, a master's in cancer, but you will be applying what you learn in that course specifically to dementia care, so you'll be asked to tailor it to dementia care. Clinical science of dementia also starts at the beginning of the course, and it's interwoven with the weeks that you will spend doing the measurement and evaluation module. This is a very core module which is taught at the Institute of Psychiatry and is led by a couple of our clinical academic psychiatrists. And what you'll, as the name suggests, what you'll be expecting to learn on that course is all about the normal way a brain works and what types of things happen when somebody has dementia, and being able to differentiate the different types of dementia, so the biology of what happens during dementia. You'll hear about pharmacological interventions in dementia, and you'll also hear a little bit about clinical trials as well. Both of these two modules have one assessment due after the end of the module, and these modules finish just after Christmas, so the first assessments would be due just after Christmas. All of our assessments, talking about assessments, all of our assessments are pretty much written assessments, different styles of written assessments, but we do have a poster presentation in the dissertation, which I'll tell you about in a bit. Another module which is taught down at the Waterloo campus is this one called Evidence-Based Decision-Making in Healthcare Practice. And this module is really about how you critically analyse, search in the literature around a particular topic, and how you will critically analyse that data. Again, you'll be taught alongside students doing other specialty master's courses, but you will be applying it to your knowledge gained as you go along in dementia care. The next module here on the list, Care and Dementia, runs from around about now actually until May, June of your first year, or in the case of full-time students, it will be the same time in your only year. And this particular module is all about the non-pharmacological interventions relating to dementia care. It's all about learning about person-centred approaches to care. You'll hear about end-of-life care, quality of life care, that type of thing. I can certainly elaborate on any of the details of what's in these modules if you have any questions at the end. So don't forget to type in your questions as we go along, and we can answer them when we get to the end. This next module, Leadership and Change in Dementia Care, is all about how you can apply the knowledge that you're learning in the area of dementia care in relation to leading and change, as the name suggests, applying what you've learned going forward, whatever organisation that you're in. This module is actually is led by Neil Robertson, who's here with me today, and his colleague Stephanie Daly. So I don't know, Neil, if you want to say just a few words about your module.
I think the module is focusing specifically on understanding what we mean by leadership and what models of leadership are going to apply effectively to leading dementia services. In addition to that, obviously we will be exploring change management processes. The course also looks at strategy. It looks at process consultation to help affect change within services, and we also look at outcomes in relation to delivering high quality dementia care. So it's about everything that you've learned on the two core modules. We take that information and we start helping you to think about how you can influence or lead change within your own organisation.
And the assessment on that module is a portfolio that you put together, which allows you to reflect on your own practice and the things that you've learned in the course.
And there's an assessment. There will be an essay on reviewing the literature around leadership and change theory.
The largest of all of the modules, as you might expect at master's level, is the dissertation, and we work with you at an early stage to find out what your interests are and the types of things that you want to do as a project for your dissertation. It might be that we can provide a list of potential supervisors and their areas of interest that they're currently researching on, and you can meet with them and make a decision about what project you want to work on. Or you can come and see us and decide, give us an idea about what you want to work on, and we'll help find you a supervisor that can help you with that. It might be that you carry out the research at the Institute of Psychiatry, or it might be that we can offer you a local supervisor, but in fact you might want to do the project in your current workplace, for example. So there's lots of different options that we can explore with you. The only consideration that might be important for deciding on what your project is if you need to go through the process of gaining research approval and ethical approval for perhaps having, for example, interviewing patients as part of your research. So if we can work with you at an early stage to establish the types of projects and what's actually logistically possible, then we will do that and guide you on that. So I'm going to hand over now to Neil Robertson, who's going to tell you a little bit more about our course in relation to the biopsychosocial model.
Okay, we thought this would be a useful opportunity just to give you an overview of what we mean in relation to a biopsychosocial model for dementia care. So if we look at the biomedical view of dementia, what we have here is a set of very rigid criteria in terms of thinking about dementia as a pathological and individual disease process. That its etiology, its underlying etiology is organic, which impacts on the higher brain functions, which are important for controlling cognitions and behaviours. And it's treated and managed according to medical authority. Now, this was a very dominant view of the management and care around dementia up until the early 1990s. At that point, in the early 1990s, Tom Kitwood, who was a social psychologist and was one of the founding members of the Bradford Dementia Group, started to research and try to develop more insights into the experience of dementia. And what he did as part of that was to develop this formula, which is dementia equals personality plus biography plus health plus neurological impairment and plus social psychology. And social psychology was something that was very important to Kitwood's work, and what his approach and theory was saying is that the way that we interact with people with dementia is going to have either a positive or negative impact on the person's experience. This is the person who's living with dementia. And as we see from the formula, personality and biography, or the person's life story, they are set. They are things which we can't change. However, we can change a person's health because we can promote well-being, and we can look at the relationship between the social psychology, so that's the environment in which they're in and the care that they're receiving, and actually by providing positive person work or positive social psychology, this can have a positive impact on neurological impairment. What Kit Wood's work was very important in making clear was the idea of personhood and well-being, and that the way that individuals and society view people with dementia could potentially be undermining who they are as an individual. And what Kit Wood suggested was the idea of personhood should be upheld, and it should be held central to any care intervention. And he referred to this as a standing or status that is bestowed on one human being by others in the context of relationship and social being. It implies recognition, respect, and trust. And we should be seeing the person as a person in their fullest possible sense. He or she is still an agent who can make things happen in the world. They're sentient, relational, and historical beings. And again, it was about really being clear about the values that individuals in society should think about when working with people with dementia and supporting people with dementia. And some of you may be aware that we're actually starting to see some quite important societal changes if we think about the National Dementia Strategy and also the Prime Minister's challenge on dementia, which is clearly emphasising the importance of dementia-friendly communities. Some other work that has started to be developed more recently is the work of Mike Nolan and his colleagues, who's a professor of nursing at Hull University. And he's given us some useful insights in terms of thinking about the care environment. And when we're talking about the environment, not just thinking about the physical building, what we're talking about is all aspects of that care environment. And he described that in some care settings, this is across the board for people, for older people accessing health services, that they may experience poor physical environments, that are poorly resourced, poor staff attitude, no sense of belonging. There's a focus purely on physical care. There's poor continuity of care, and we do not inspire. So the services don't inspire staff to want to work in that area. And quite often, the service user is left feeling insignificant, and the care is not delivered in accordance with their values and status. What Nolan also did was describe what a enriched environment, and what Nolan and his colleagues talk about is the six senses of care. And this is a framework which provides everybody within the caring relationship, so that's the service user, the staff member, and the carer, with security, continuity, belonging, purpose, achievement, and significance as people, specifically for people with dementia. Next, we just wanted to give you a little bit more of a historical background in relation to where this concept of a biopsychosocial model came. And George Engel, who was a psychiatrist, challenged the medical establishment about the biomedical model. So if you think back to our first slide, when we were talking about how dementia is understood from a biomedical model, he felt that this model was limited, and we need to understand more than the pathological processes. So we just need to move away from purely focusing on the organic process or the neurological impairment. He also said that we need to understand a person's psychology and their behavioural dimensions in relation to their illness. And we also need to think about this in relation to their social context. So he proposed a biopsychosocial model, and he felt that this was a very important blueprint for research and education. And it's important to note that Engel's work was adopted by the World Health Organization in the early 1990s, and often when we look at literature from the World Health Organization, they will be talking about the importance of a biopsychosocial model. We just also wanted to share with you this useful model of thinking about what biopsychosocial care should look like. So Spector and Orrell in 2010 published this model that they developed. And if you just look at it in relation to the centre, where we're looking at really the timeline. We're talking about ageing process. We start to see some organic changes. I think first of all, it's important to note that as we get older, we will see some very small changes to the brain. But obviously, we recognise that for some people, they will potentially start to experience symptoms of dementia. Now, the timeline in terms of thinking about the person's experience from the point of diagnosis is that in the mild stages of dementia, we get a phase where people are often living independently. But as the disease progresses, people start to become more increasingly dependent. What Spector and Oral thought was important to emphasize that actually just because a person's is becoming increasingly dependent does not necessarily mean that they are going to be immediately institutionalized or require a high dependency interventions. And what we need to do, if you look just here in terms of the potential function, is that we need to enhance this. And we can do this by thinking about what biological, psychological, and social factors are fixed in relation to the disease, and what psychological, social, and biological factors can be changed. So what they have done is provide a framework for thinking about what the fixed factors are in relation to biopsychosocial interventions, and then also thinking about what things we need to focus on to improve the person's quality of life. So pulling this all together, what we have developed in relation to the course is a program, is an advanced program which looks at the psychological, biological, and social factors of dementia. In that, we've also talked about treatment and care, and treatment and care will come across all three domains. We also want people to have an opportunity to have a real clear understanding of the research in relation to dementia treatment and care, and we also want to provide you with an opportunity to increase your capabilities in understanding research, and we really hope this will also provide a platform for you to actually actively be involved in research in the future. We also need to think about this in terms of the international, national, and local policy context. And once we have acquired all this knowledge, we then need to see about how we can use this knowledge to lead and change services so we're improving the quality of care for people with dementia.
So that concludes the formal part of what we were going to present, but we were hoping that you might, we invite your questions, any that you might have now that you've heard all of that. So it might be about the practicalities of coming and doing the course, how you might apply different aspects of doing the course, or it might be in relation to the types of things that you are learning. So please feel free to type in your questions and we will answer them. If you wanted to know more about what it's like to be a student at King's, you can see there that I've put a website which will take you on a virtual tour of King's, for those of you that aren't very familiar with London at all. If you want to find out more about our course and perhaps make an online application, I'm sorry for the length of the website there, but there's information there on how you might be able to do that. And of course, at any time in the future beyond this webinar, if you have any questions, then feel free to email us at the email address that you can see there. I should also point out that if you have a look on the online prospectus, there's not only information on how to apply, but for those of you that it might be important, you can also find links to funding. So it might be that there's funding for which you're eligible for that might assist you in coming and doing the course as well.
As we said, if there are any other questions you think about after the presentation, then please feel free to contact us.
Yeah. If you want a phone number because you'd rather speak to us over the phone, then the information is available on the website on the prospectus, but you may also email us and we can give you a phone number that you can contact us at. This webinar will be available as well in the future, so if you have any colleagues who may not have been able to hear it today, then please let us know and we can tell them how they might have access to it. So thank you very much for participating today in the webinar. I hope you found it useful, and well, please let us know. Please have feedback because this is actually the first webinar we've done, so we hope that you got something out of it.